Hi everyone, this is Katie and I'm an occupational therapy student at Rockhurst University. Today I will be talking about safe sleep positioning after having a stroke. The specific topics I will be discussing include the benefits of getting good sleep, some negative effects of getting poor sleep, why proper body positioning is important after having a stroke, the different sleep positions to ensure your affected side is safe and you are comfortable when lying down, and some additional caregiver education. So, what are the benefits of good sleep? Well, there are many. In order for the human body to properly function, it is important to get enough sleep that your body requires. Sleep plays a very vital role in our health and well-being. Healthy sleep allows the body and mind to recharge, which leaves you feeling refreshed and alert the next day. By properly recharging your body every night, you are more likely to be healthier due to better immune functioning. You're more likely to help fight off stress. You're more likely to have improved cognition and show overall signs of improved mood. It is recommended that adults get at least 7 to 8 hours of sleep a night. The environment you're in and your sleep positioning can greatly impact your quality of sleep. There are many negative health effects that can occur if an individual doesn't get quality sleep. Some of these include having a lack of alertness, which can ultimately cause things like safety concerns, daytime sleepiness, which is feeling extra tired throughout the day, having impaired memory, having a greater risk of long-term health problems like high blood pressure, diabetes, and heart-related issues, and an overall decreased quality of life. Because stroke can cause a lack of feeling and sensation in the affected limbs, it is common for stroke survivors to become less aware of their affected side, which can ultimately cause more harm and discomfort. Good positioning can help individuals improve their quality of sleep, prevent more harm to the affected limbs, and also prevent future pain that may be caused by poor body alignment when sleeping. Correct positioning can also help reduce the risk of unnecessary shoulder pain, pressure areas, contractures, loss of range of motion, and swelling of the extremities. It's important to maintain correct skeletal alignment to prevent things like this from happening. Your positioning needs will depend on how severe the stroke was and the parts of your body that were affected. The next few slides, I will be talking through different positions that can help you stay safe and hopefully get better overall sleep because of increased comfort. It is important to always talk to your doctor before making changes to your routine, as this is for educational purposes. Also, be sure to ask for help or assistance if needed from your caregiver. For each picture I show, the dark shaded area is the person's stroke affected side. The first picture shown here on the left is a person lying on their back in bed, also known as lying in a supine position. To properly lie on your back in bed, you should first place a pillow directly under your head. Next, place a different pillow under the affected shoulder, elbow, forearm, wrist, and hand. Your legs should be straight out in front of you. The second position shown is a person sitting up in bed. This is a good position if you are wanting to remain in bed to maybe do things like read or watch TV. To ensure your body is in proper alignment, prop the first pillow you have under your head directly behind you. Next, place a second pillow under your affected shoulder, elbow, forearm, wrist, and hand, and be sure to keep the arm mostly straight. Make sure your legs are straight and directly in front of you. The next position shown here is a person lying on their unaffected side. To get in this position, place 1 or 2 pillows under your head. Next, stack 1 or 2 pillows under your affected arm in a forward position and 1 or 2 pillows under the affected leg. Be sure to keep the hip and knee bent. For extra safety, you can place a pillow behind the back to prevent rolling backward. This position can let you practice doing tasks with your affected side. The last position shown here is lying on your affected side. To do this, start by placing 1 or 2 pillows under your head. Next, lie on your affected side and straighten out your affected arm. The affected shoulder should be well forward so the body weight is properly supported. Then, place your non-affected leg forward with 1 or 2 pillows underneath for extra support. Make sure your hip and knee are bent and your affected leg is straight. This position is nice because it leaves your unaffected side available for tasks. Those are all the positions I will go through, so please feel free to go back and pause this video at any time to try out the positions and see what is most comfortable for you. Next, I want to briefly go over some additional information for caregivers who might be assisting with these positions. Be sure to always help with positioning as needed. It can be difficult to place pillows in certain positions and ensure extremities are in proper alignment after having a stroke, so your help is always encouraged. Always make sure the individual is safe by having all of their extremities in good position and proper skeletal alignment. To help prevent skin breakdown or pressure sores, it is recommended to reposition occasionally and to not stay in certain positions for long periods of time. Always be sure to listen to the individual's needs and listen to what position is most comfortable for them. And lastly, these are the resources I used. Please feel free to reach out if you have any further questions. Thank you all for listening.